Dorothy is 72 years old. She had been waking up with leg cramps for almost 3 years. She had tried the usual things: magnesium supplements, stretching before bed, more water. She had read every article she could find. The cramps kept coming. Then she added one specific routine to her evenings. Not a stretch, not a supplement, not anything related to her legs directly. By the fourth night, her cramps had reduced significantly. By the end of the week, they were gone. Now, before I show you what she did, I want to make sure we are talking about the same experience. If your legs give you a crawling, itching, restless sensation at night, an urge to move that you cannot resist, that is a different condition, and that video is already on this channel. Today is specifically for the hard, painful cramp that jolts you awake, the kind where you bolt upright and grab your calf, the kind Dorothy had, because the answer to Dorothy's leg cramps wasn't in her legs at all. And once I show you where it actually was, you will understand why everything she had tried before didn't work. Let me start with the nerve at the center of this. The vagus nerve is the longest cranial nerve in the human body. The word vagus comes from the Latin for wanderer, and that name is exactly right. It begins in your brainstem, travels down through your neck, branches through your chest, wraps around your heart and lungs, and descends into your abdomen, connecting your brain to almost every major organ along the way. Its primary job is to activate the parasympathetic nervous system, the branch of your autonomic nervous system responsible for rest, recovery, and repair. When vagal tone is high, your body is in a genuinely restorative state. Heart rate slows, blood pressure settles, digestion works, muscles relax and release tension properly. When vagal tone is low, when the parasympathetic system is underactive, the opposing branch dominates, the sympathetic system, what most people know as the stress response. And that is where the connection to leg cramps begins, not in your leg, in your nervous system's relationship with stress. Because the vagus nerve's relationship with leg cramps has nothing to do with the nerve traveling to your leg. It has everything to do with what a chronically activated stress response quietly does to the one mineral your leg muscles cannot function without. And for many people over 60, especially those who take magnesium supplements that don't seem to help, this is the explanation. They have been missing for years. And once you understand it, Dorothy's story makes complete sense. When your body is under chronic stress, not dramatic stress, just the low-level, persistent kind that many people over 60 carry without fully recognizing it, your stress hormones, including cortisol, remain elevated for extended periods, and elevated cortisol triggers a specific response in your kidneys. Your kidneys begin excreting magnesium through your urine at an increased rate. This has been confirmed in peer-reviewed research, including a review published in Nutrients, which found that during periods of acute and chronic stress, a measurable decrease in the body's magnesium levels occurs alongside an increase in urinary magnesium excretion. A separate analysis specifically examining cortisol found that elevated cortisol levels directly prompt increased magnesium loss through the kidneys, and that this loss perpetuates the stress response, making cortisol harder to bring down. Now, here is why that matters for your legs. Magnesium is essential for muscle function at the cellular level. Calcium causes muscle fibers to contract. Magnesium causes them to relax. When magnesium levels drop, muscles lose their ability to release tension properly after a contraction. They stay partially contracted. Motor neurons become more excitable, more prone to firing without a strong enough trigger. And the result, especially during the low protection window of 2 to 4 a.m., is a sudden involuntary spasm. That is a leg cramp. Now, here is what made Dorothy's case so instructive. She was already taking a magnesium supplement every day, and it wasn't working. The reason wasn't the supplement. The reason was that she had been caring for her unwell husband for over 2 years, a situation of sustained, quiet, unrelenting chronic stress. Her cortisol was persistently elevated, and her kidneys were excreting magnesium faster than she could replace it through supplementation. She was filling a bucket with a hole in it. The research describes this dynamic as a vicious circle. Low magnesium increases stress reactivity, which raises cortisol further, which depletes more magnesium. The cycle reinforces itself. The leg cramps become more frequent and more severe over time. And no amount of magnesium supplementation breaks the cycle, because the cycle isn't about how much magnesium you put in. It's about how fast your stress system is pulling it back out. Breaking that cycle requires addressing the sympathetic overdrive. And the most accessible, evidence-supported way to shift the nervous system back into parasympathetic recovery is through the vagus nerve. The routine I'm about to show you is not targeting your leg muscles. It is targeting the stress system that has been draining the mineral your leg muscles need. And that distinction, going upstream to the cause rather than downstream to the symptom, is what makes the difference between a technique that works and everything Dorothy had already tried that didn't. Dorothy used a sequence of 4 vagal techniques in the 60 to 90 minutes before bed. I call it a sequence rather than individual exercises because each one builds on what the one before it has already started. And together they produce a cumulative parasympathetic shift that a single technique alone cannot reliably achieve. Let me take you through each one. The first technique, the humming breath. Sit comfortably. Take a slow, deep inhale through your nose. Then, as you exhale, hum. A steady, low, audible hum for the entire length of the exhale. Do 10 cycles. The vagus nerve has branches running through links and the pharynx, the throat, and the vocal structures. When you hum, the vibration mechanically stimulates those branches directly. Research into vagal anatomy confirms that the pharyngeal and laryngeal branches are activated through vocal vibration, sending signals through the nucleus tractus solitarius in the brain stem, the relay station that coordinates parasympathetic output throughout the body. At the same time, the long exhale required to sustain the hum activates the parasympathetic system through the respiratory pathway. You are getting 2 separate activation mechanisms in a single breath. The pitch doesn't need to be specific. A natural, comfortable hum is enough. Feel for the vibration in your chest and throat. That sensation is the signal that the nerve is receiving it. The second technique, the cold neck compress. Soak a small towel or flannel in cold water. Place it on the back of your neck and the sides of your neck for 30 to 60 seconds. Cold water applied to the face and neck triggers what physiologists call the dive reflex, a well-documented response in which the vagus nerve is rapidly activated, heart slows measurably, and parasympathetic tone increases quickly. Research has confirmed immediate, measurable heart rate drops following cold facial exposure through the vagal mechanism. You don't need ice water. Cool to cold tap water is enough. 30 to 60 seconds is sufficient to trigger a meaningful response. This is the fastest and most powerful signal in the sequence. A direct instruction to the nervous system to shift state. The third technique is the one that surprised me most when I first read the research, because the specific frequency matters, and this is not what most people think of when they think of slow breathing. Resonance breathing. Breathe in for 5 counts. Breathe out for 5 counts. Equal inhale and exhale. That's approximately 5 to 6 full breath cycles per minute. Do this for 5 minutes. Research published in Frontiers in Human Neuroscience found that breathing at approximately this specific frequency produces maximal heart rate variability, the most reliable measure of vagal tone. At around 5 to 6 breaths per minute, the rhythm of your breathing synchronizes with the natural oscillation of your cardiovascular system in a way that generates the strongest measurable parasympathetic response. This differs from the extended exhale breathing discussed in earlier videos. That technique activates the parasympathetic system through the exhale to inhale ratio. This one activates it through resonant frequency. They work through different mechanisms. Both are useful. This one, in research terms, produces the highest peak vagal activation. A quiet timer set to a 5-second interval helps maintain the rhythm without effort. Let the timer breathe with you. The fourth technique is the one my patients laugh at when I describe it, and then stop laughing after the first week. The gargle. Take a mouthful of water, tilt your head slightly back, gargle vigorously for 30 to 60 seconds. Hard enough that you feel it working at the very back of your throat, ideally hard enough that your eyes water slightly. Do this 2 or 3 times. The pharyngeal branch of the vagus nerve controls the muscles involved in swallowing and throat contraction. Forceful gargling repeatedly contracts and activates those muscles, generating strong afferent signals, nerve signals traveling upward from the throat to the brainstem's vagal complex. A 2024 review confirmed that stimulating the pharyngeal and laryngeal pathways in this way activates the nucleus tractus solitarius, the same brainstem relay station that coordinates parasympathetic output to the heart, lungs, and gut. One additional note that may be worth knowing. Some functional neurologists observe that if gargling feels very difficult or produces almost no gag reflex at all, that can itself be a sign of low vagal tone. If that applies to you, it is another reason to keep practicing. The difficulty is the point of entry, not a reason to stop. Now, these 4 techniques produce their strongest effect when done together. In this sequence, in 60 to 90 minutes before bed. Not right at bedtime, not at dinner. That specific window matters in a way that most people don't expect. And the reason why is the same reason the cramps happen at 3 a.m. and not at 3 p.m. The goal of this routine is not to relax before sleep. The goal is to change the conditions your Nervous system enters the high-risk cramp window in. The 2 to 4 a.m. window is when motor neurons in your legs are most vulnerable. When protective neurochemical levels are at their lowest, when muscles have been shortened by hours of sleep position, and when electrolyte levels are at their nightly low point. By activating the vagus nerve consistently in the 60 to 90 minutes before you close your eyes, you are shifting the autonomic balance toward parasympathetic dominance before that window arrives. Cortisol begins to fall. The kidneys receive the signal to conserve rather than excrete. The magnesium already in your system has a better chance of staying where your muscle tissue needs it through the night. You are not fixing the problem at 3 a.m. You are changing the conditions that create it, hours before they would otherwise take hold. Dorothy noticed the difference by the 4th night. Several patients after her reported similar timelines, a meaningful reduction somewhere between night 3 and night 6 of consistent practice. I want to explain why that timeline makes biological sense, because understanding it is what keeps you in the routine during the first 3 nights when nothing has changed yet. The autonomic nervous system does not shift immediately. The vicious circle between chronic stress and magnesium depletion took months to establish. A single evening of vagal exercises cannot reverse it overnight, but research on vagal tone shows that consistent parasympathetic activation over several consecutive days produces a cumulative shift in baseline autonomic state, much measurable through heart rate variability, which improves progressively over the first week of consistent practice. As that baseline shifts, cortisol levels begin to normalize. As cortisol normalizes, the kidneys begin conserving more magnesium. As magnesium levels in the muscle tissue stabilize, motor neuron excitability decreases. As motor neuron excitability decreases, the threshold for triggering a cramp rises. That progression from first session to meaningful physiological change takes roughly 3 to 7 days. Nights 3 through 6 are when the cumulative effect of that shift first becomes noticeable, as fewer cramps or none, which is why the first week is the most important week. Do not judge this routine on night 1 or night 2 or even night 3. Give it 7 nights. Every night, the same sequence, the same timing window. That is what Dorothy did. Let me bring this together, because I want to be clear about what you are actually doing when you do this routine and why it is a fundamentally different approach to leg cramps than anything most people have tried before. Most approaches to leg cramps target the muscle. Stretch the calf. Take magnesium. Drink more water. Those things can help. But they don't address what is often the deeper driver. A nervous system stuck in chronic sympathetic overdrive, slowly and continuously draining the mineral the muscle needs to relax. What this routine does is go upstream. Addresses the stress system that is causing the depletion, rather than trying to replace what the stress system keeps taking away. That is why it works when supplements don't. Here is what to do. In the 60 to 90 minutes before bed, in this sequence, 10 cycles of the humming breath, exhaling with a low audible hum each time, then 30 to 60 seconds of the cold neck compress, a cool, damp cloth on the back of your neck, then 5 minutes of resonance breathing, 5 counts in, 5 counts out, steady and slow. And finally, 2 or 3 rounds of vigorous gargling, 30 to 60 seconds each. Every night for 7 nights. Don't skip a night in the first week. The cumulative effect is the point. Dorothy described it this way. She said, I had been fighting my legs for 3 years, and the thing that finally changed it turned out to be calming my nervous system. I had no idea the two were even connected. Now you do. Drop a comment and tell me, are you currently taking a magnesium supplement that doesn't seem to be making a difference? That is often the clearest sign that this approach may be the missing piece. I read every single response. And if someone you know has tried everything for their leg cramps and nothing has worked, please share this video with them. The vagus nerve connection is the one most people have never heard of. It may be the one that finally makes the difference. Before you go, we have now covered 5 videos in this series. The nerve misfiring at 3 a.m. What blood pressure medications may be doing to your leg nerves over time. The lymphatic system failing every afternoon. What restless legs are warning you about. And today, the vagus nerve, the stress magnesium vicious circle, and why calming your nervous system may do more for your leg cramps than any supplement you have tried. And running through all 5 of those topics is a single thread we haven't fully pulled yet: the gut. The vagus nerve we talked about today is the primary communication pathway between your brain and your digestive system. And the research coming out in 2025 is showing something that changes the picture significantly. The health of the bacteria living in your gut directly influences the tone of your vagus nerve, which means it influences your stress response, your magnesium retention, your nerve health, and through the exact pathway we described today, the frequency of your leg cramps. Next week, I'm going to show you what happens to your gut microbiome after 60, that your legs feel the consequences of. What the published research actually says about the gut-nerve-leg connection, and what you can do with what you eat to start shifting that system in your favor. Subscribe, because the gut-leg connection is the piece that ties this entire series together, and it may be the most important video we have made yet.